Thank you for being here, and I appreciate your willingness to give us your time. Today we're going to discuss chronic pain. The terms chronic pain and persistent pain are often used interchangeably. Pain is said to be chronic if it persists beyond the normal healing time of about 3 months. Chronic simply means ongoing and doesn't tell us much about the severity or quality of the pain. What causes chronic pain syndrome? When you have an injury or illness, certain nerves send pain signals to your brain. With chronic pain, these pain signals keep going for weeks, months, or even years after you recover. Chronic pain can develop after a major injury or illness, such as a back injury or shingles, or it can happen without a known cause. It's also possible that certain brain chemicals that usually suppress pain stop working the way they're supposed to. Symptoms of chronic pain syndrome. Symptoms often begin after an event such as physical trauma, surgery, infection, or significant psychological stress. In other cases, symptoms gradually accumulate over time with no single triggering event. Women are most likely to develop fibromyalgia than men. Many people who have fibromyalgia also have tension headaches, temporomandibular joint or TMJ disorders, irritable bowel syndrome, anxiety, and depression. Ways to relieve chronic pain. Exercise. Some exercises have been proven to help with chronic pain symptoms such as stretching, walking, yoga, Pilates, weightlifting, water aerobics. Physical therapy. In a physical therapy session, you may do a mix of low-impact aerobic training, strengthening exercises, pain relief exercises, stretching, heat and ice packs, and massage. Painkillers. Acetaminophen, ibuprofen like Advil, Motrin IB, and others. Naproxen sodium like Aleve. Celecoxib like Celebrex and Consensi. Tricyclic like amitriptyline, and nortriptyline like Pameler. Hydrocodone like Hysingla, Zohydro ER. Hydrocodone acetaminophen like Norco, Annexia 5 3-5, fentanyl like Actic, Duragesic 100, oxycodone like OxyContin and Roxicodone, oxycodone acetaminophen like Percocet and Roxicet. Trigger point injections. Trigger points are painful knots in your muscles. They form when a muscle can't relax. Sometimes you can feel those knots when you rub your muscle. Injecting small amounts of anesthetic and steroid into the trigger point can help alleviate the pain. Surgical implants. Spinal cord stimulators deliver electric current to the dorsal columns of the spinal cord to block or alter neural pain signals. Peripheral nerve stimulation is a technique that was not widely used because of concerns for potential trauma to the peripheral nerves. However, in recent years, there is renewed interest in stimulation within peripheral nerve fields, with electrodes kept at a safe distance from the major peripheral nerves. Spinal pump technology allows for the continuous infusion of medication directly into the cerebrospinal fluid or CSF. This has enabled clinicians to deliver more potent doses of analgesics with lower systemic side effects. Bioelectric therapy. Bioelectric therapy is a new technology used to improve nerve, muscle, and glandular imbalances. It is used in anti-aging and cosmetic protocols, along with stress management and reducing anxiety. Bioelectric therapy uses a low current on tissues and conditions to create beneficial changes in symptoms of diseases to balance the health. It sends out electrical impulses that block or interfere with the body's pain signals, leading to reduced pain. It helps relieve endorphins, or chemical messengers, that naturally decrease pain in the body. It stimulates muscle tissue to contract to reduce atrophy. Physical therapy. Hot and cold therapy such as hot packs, hot or cold whirlpool baths, or ice packs. Psychological treatment. Consult a professional. Find support. Engage in activities you enjoy. Talk to yourself constructively. Learn how to deal with your stress in healthy ways. Nutritional supplements. Turmeric, devil's claw root, capsicum, comfrey, glucosamine, white willow bark, boswellia, caffeine, feverfew and butterbur, omega-3 fatty acids, and probiotics. Herbal remedies. Peppermint essential oil, eucalyptus essential oil, cloves, capsaicin, rosemary essential oil, and lavender essential oil. What food helps with chronic pain? Number 1. Tart cherries. Tart cherries carry antioxidants that can aid in the fight against cancer. They also have cyanide, an inflammation-fighting agent, which according to Dr. Paul can work better than aspirin in helping to reduce joint or muscle pain. Cherries also aid with reducing the pain associated with gout or arthritis. Number 2. Soybeans. Because soybeans are high in protein, they have compounds that can slow oxidation and decrease inflammation. Number 3, cold water fish. Fish can help fight inflammation, heart disease, and cholesterol since it's full of omega-3 fatty acids. Dr. Pol recommends eating cold water fish like tuna or salmon. Number 4, turmeric. Turmeric contains curcumin, which is a compound that research suggests can help fight cancer and inflammation. Turmeric can be used to season rice, lentils, eggs, or even fruit smoothies. Number 5, vitamin D. Because chronic pain can be worsened by vitamin D deficiency, it can help to take supplements or eat food rich in vitamin D, such as egg yolks or fatty fish like salmon or trout. Dr. Pol does not recommend cow's milk, however, as it can worsen arthritis and sinus congestion and can cause headaches and indigestion. Number 6, cocoa. Dark chocolate can help to decrease pain related to inflammation, such as the cocoa in chocolate contains flavonols, an inflammation-fighting agent. Number 7, fruits and veggies. Vegetables that contain protective nutrients include watercress, spinach, parsley, kale, red peppers, broccoli, arugula, cauliflower, and carrots. Fruits that are a rich source of antioxidants and anti-inflammatory properties include cranberries, red grapes, and blueberries. Some other advice to manage chronic pain. Learn deep breathing or meditation to help you relax. Deep breathing and meditation are techniques that help your body relax, which may ease the pain. Tension and tightness seep from muscles as they receive a quiet massage to relax. Don't smoke. It can worsen chronic pain. Smoking can worsen painful circulation problems and increase the risk of heart disease and cancer. Stop drinking alcohol. Alcohol use, which is not that good at addressing chronic pain anyway, ultimately makes the pain worse. When a person withdraws from chronic alcohol use, pain sensitivity is often increased. Sadly, this can motivate some to continue drinking or to drink even more. Additionally, prolonged excess consumption of alcohol can cause small fiber peripheral neuropathy. This type of neuropathy causes symptoms like pain, tingling, pins and needles sensations in the extremities, or altered sensations, especially in the feet. Whatever short-term relief from pain alcohol may provide, at least at first, is far outweighed by more pain over the long term. Can chronic pain be caused by depression? People with chronic pain are 3 times more likely to develop symptoms of depression or anxiety, and people with depression are 3 times as likely to develop chronic pain. Depression frequently can cause unexplained pain, such as headaches or back pain, and people who are depressed might struggle to improve or maintain physical health. In turn, chronic pain can lead to trouble sleeping, increased stress, or feelings of guilt or worthlessness associated with depression. These influences can create a cycle that is hard to break. The effects of age on chronic pain. A meta-analysis comparing age-related differences in pain perception found that the highest prevalence of chronic pain occurred about age 65. A slight decline with advancing age followed, even beyond the age of 85. Chronic pain disorders are less frequent. How does chronic pain affect the brain? Researchers have confirmed that chronic pain doesn't just cause physical discomfort, it can impair your memory and your concentration. In a recent study, 2/3 of participants with chronic pain showed significant disruption of attention and memory when tested. Can chronic pain cause extreme fatigue? Chronic pain makes it hard to get restorative sleep, and the lack of sleep can have sufferers wake up in increased pain. Less quality sleep can decrease one's pain threshold and pain tolerance as well as intensify the pain. Sleep is necessary for the body to heal and repair itself. A well-rested body has a better chance of feeling physically better because sleep supports a stronger immune system, which can help reduce the inflammation that comes with the injury, infection, or illness that is causing the pain. How chronic pain affects your immune system. Another reason chronic pain impacts immunity is stress. Ongoing pain triggers the stress response of the body. When the pain is persistent, the body is in a constant state of stress. This long-term and persisting stress response increases the level of cortisol, a hormone. And a rise in cortisol levels have been known to decline immune function. Some chronic pain is related to chronic diseases, which negatively impact the immune system. In such cases, the body is in a prolonged state of inactivity. Add to it chronic stress, and it causes elevated blood pressure, weight gain, and other risk factors. This in turn can lead to the development of diabetes, stroke, and other heart conditions. Chronic pain changes personality. Chronic pain has a notable and drastic effect on the personality of those who suffer from it. One of the most overt one of these changes is in terms of motivation. Those with a chronic condition can still have the desire to get things done, but quickly lose their will when faced with a challenging or unexpected situation. Also notable is that chronic pain creates a kind of passiveness in overall behavior. The ability and desire to take risks or move outside one's comfort zone becomes greatly reduced. Aside from this numbing of ambition and adventurousness, sufferers also become more anxious, worrying more and regularly second-guessing themselves. Patients with long-term pain conditions become more easily frustrated in general, which can lead to a more on-edge or angry personality. People change their feelings of pain into anger because it feels better to be angry than it does to be in pain. This changing of pain into anger may be done consciously or unconsciously. Being angry rather than simply being in pain has several advantages, primarily among them, a distraction. How does chronic pain affect activities of daily living? The most common musculoskeletal diseases, osteoarthritis, osteoporosis, and back pain, lead to impairments in quality of life and in activities of daily living, or ADLs. As a consequence, they further lead to dependency, institutionalization, and increased healthcare costs. How does chronic pain affect relationships? Chronic pain can lead to sexual problems. When you are in pain, the last thing you probably want to do is to be intimate with your partner. But it is important to remain close to your loved one. A healthy, intimate relationship can positively affect all aspects of your life, such as fear of rejection by a partner. It is common for people with chronic pain to feel that a partner is no longer interested. You may wonder if a partner is less attracted to you because you're in pain. Share your feelings and fears with your partner and listen to your partner's concerns. Fear of pain associated with sex. It is natural to worry that sexual intercourse will cause you more physical pain. You can address this concern by experimenting with different, more comfortable positions. Fear of failure to perform. Pain, depression, alcohol, and medications all can affect sexual performance or the ability to get aroused or have an orgasm. Sometimes failure to perform is caused by stress and anxiety. In many cases, patience and understanding can help in overcoming performance problems. Many medications can reduce your sexual ability and/or cause impotence. If you suspect a medication may be affecting your sexual performance, don't stop taking the drug without first consulting your healthcare provider. Chronic pain and kidney. Many diseases can irreversibly damage or injure the kidneys. Acute kidney injury becomes chronic disease if kidney function does not recover after treatment and lasts more than 3 months. Therefore, anything that can cause acute kidney injury can cause chronic kidney disease. Other risks of long-term chronic pain. Greater risk of dementia. A recent study at UC San Francisco has shown that older people with chronic pain are more likely to have dementia years later. Possible causes include the use of opioids, the pain-causing memory and other cognitive functions to be stifled, or another factor that was not measured in the study. People who said they were persistently troubled by moderate to severe pain declined 9.2% faster in their tests for memory and cognition than those without pain. Early intervention of pain can be effective in preventing these long-term effects. If the effects of chronic pain have already set in, it is best to treat it from an interdisciplinary perspective. Depending on the patient, exercise, physical therapy, a balanced diet, and/or prescription medication might be effective treatments. Dorn's programs are designed to attack pain before it becomes a chronic issue and also to treat pain at its worst. Our treatments improve sleep patterns, reduce sick days, and boost productivity, among many other benefits. That's all we have for today. Thanks for watching. If you have anything to add, please leave a comment down below and hit the subscribe button.